Hello, everyone, and welcome. It's my pleasure to welcome you today to Susan G. Komen's virtual MBC Impact Series event. My name is Casey Volpe, and I am with Komen's Community Education and Outreach team. The programming for this series is envisioned as a year-long conversation with attendees where we present new information and speakers on various topics every month. And today we'll be covering patient self-advocacy. Our featured speaker is Tony Lee, and she's a patient navigator here at Komen. Before we begin, Komen would like to thank our sponsors for supporting the 2023 MBC Impact Series. So thank you to AstraZeneca for being our technology sponsor for this year's event. The virtual setting means MBC patients, no matter where they live, can be part of this community. We would also like to thank our premier sponsor, GE Healthcare, and our signature sponsors, Walgreens and Merck. The series is made possible because of their continued generosity. One last housekeeping note, while we're speaking and having discussions, please feel free to post your questions in the Q&A feature in Zoom. You can find that icon either at the bottom or the top of your screen, and we will get to as many as we can once the presentation is complete. So we're really excited to bring this information to you today, and I won't hold us up anymore. So to start, I would like to introduce you to our moderator, Dr. Sandra Finestone. Sandra Finestone is a 30-year breast cancer survivor and research advocate who has been a volunteer for Susan G. Komen for over 25 years. She's a licensed marriage and family therapist and very passionate about educating breast cancer patients about their disease and the importance of breast cancer research. She has a long list of qualifications and accomplishments, and I will let her speak more to them, but she is a fierce advocate with a wealth of knowledge, and we are very excited to have her here today. So without further ado, Dr. Finestone, please come on board.
Thank you. Thank you for that very nice introduction. I'm not sure, can we take that down? I don't want people to have to stare at that all the time. I just want to give you a little bit of before I introduce Tony, I'd like to give you a little bit of information, not so much about my credentials, but about my cancer journey. I was diagnosed over 30 years ago. And when I was diagnosed, women were not given options and they were not given information. They were told where to show up and when to show up. And then the doctors took it from there. I found that really distressing because after my surgery, I didn't even know what the surgery was, and I was afraid to take off the bandages to find out. No one told me anything, and I didn't ask. At that time, it was inappropriate to ask questions of a doctor. After that experience, I was fortunate enough to become what was called in charge of patient services. There was no patient navigator at that time, but my role was to help the patient through the process. And as Casey mentioned, I became ferocious in making sure that patients were educated about their options. I would often tell patients, the good news is that today, and that was 15 years of my doing that, today you have options. The good news is you have options. But I'd also tell them that the bad news is you have options, because as a patient, you are asked to make that decision, and appropriately so. But patients don't know and have enough information in order to make that decision. And Tony's going to address that a little bit. I have, my mantra is, and it's kind of silly, but it's one I'm going to stick with. My mantra is, an educated patient makes a better doctor. And I believe that's true. So if patients can arm themselves with information, good information, I think that's really, really important, then they can do themselves the best service. So I do want you to know a little bit about Tony today. I'm going to read her bio because I don't want anything to be missed. She is a senior manager of patient navigation with Susan G. Komen. She's responsible for the operational and day-to-day management activities and administration of patient navigation services, focused on breast cancer support and coordination of breast care. She spent over a decade working in the nonprofit healthcare sector, gaining valuable experience working with and assisting underserved populations in various communities gain access to quality and affordable healthcare. She feels she has strong passion for healthcare equity and eliminating breast health and breast care disparities among the African American and Latinx populations. Tony attended the University of Pittsburgh, where she received a Bachelor of Science in Psychology and is currently working in obtaining her Master's in Health Administration degree at Winston-Salem State University. She currently resides in Charlotte, North Carolina, and she enjoys spending time with family, reading, and traveling. Tony states that she's honored to be part of the Susan G. Komen mission and excited to continue to keep the mission moving. So Tony, if you wouldn't mind giving us a little bit expanded view of what you do at Komen and a little bit about the patient navigation program that Komen has.
Yeah, great. Well, thank you for the introduction, Dr. Feinstone. And welcome everyone. Thank you for joining us today. My name is Tony Lee, and just a brief overview of our patient navigation program. As Dr. Feinstone mentioned, it wasn't that long ago where you didn't have options and you didn't have navigators or social workers to help kind of guide you through your journey. And that's something that wasn't mentioned in my bio as well. I am a breast cancer survivor. And so I have some personal experience about advocating for myself, even though I've worked in an oncology setting. But for Komen Services, we help to address a lot of barriers to care and get women or men services to high quality breast care. And oftentimes with our model, it's a national telehealth kind of virtual model. We're really able to reach those communities where these services may be non-existent, or again, they've had barriers to care to the healthcare system and they don't know quite how to access those services. So our navigation services seek to identify those barriers to care. Our navigators will problem solve and come up with strategies or connect to resources to address those barriers, and then hopefully allow folks to either get access to care, remain in treatment, and not have those delays or disruptions that often cause delays in care or treatment or poor outcomes. So
it's that service is absolutely wonderful, and thank you for Komen for offering it. I think when most patients, and this has been my experience, and I expect it's been yours as well, that when a patient is first diagnosed, they're overwhelmed, totally overwhelmed.
mm-hmm.
They're dropped into a world that they don't understand, one that they never expected to find themselves in. And at least as I say, it's my experience, they're listening to a language that they don't understand.
Exactly.
And I don't blame the medical community because it's a language that's everyday language to them.
Sure.
But they often forget it's not one that the patient understands.
Correct. Yeah. Yeah. And definitely, that overwhelming feeling while you're in the office, you hear, but you're not processing. And so again, sometimes that language you got to take back with you and really take a step back to one, just process your emotions and what was just told to you. But then you have to, as Dr. Feinstone just pointed out, understand, navigate this new language that you have to learn now. And again, even for someone who was already working in the oncology space, it was still difficult to say, what does that mean? And I always think about my patients who've had no experience with the oncology world, or some of our patients, minimal access to a healthcare system at all, or those who English is not their first language. Those are very difficult to navigate when you get into those terms and how that translates, and how can you break that down to where, the average person can understand what's next. What does that mean?
Right.
Yeah.
And clinicians are mostly very kind and very thoughtful, and they offer to the patient that these are the options, but your decision is yours. And that's appropriate. but how does a patient prepare themselves to make that decision? And we're going to talk a little bit about the influence of friends and neighbors and family, which
Mhm.
again, I think is a challenge that's very often not addressed.
Mhm.
And everyone wants to help, but they come with even sometimes even less knowledge and information than the
Right.
patients themselves.
Sure.
So how do you address that in the program that you're managing?
Yeah. Well, one of the ways is just to get connected to either a patient navigator or a social worker, or bring someone with you to your initial appointment, so that you can have an extra set of ears to maybe help you decipher and digest what was told to you. Um, but I think, again, it's kind of starts with after you've learned of your diagnosis or your treatment, organizing your thoughts, organizing the information, and really sorting out, I understand this, I don't understand this, this is where I could use some more clarification. And then from there, that's a good starting point to start maybe formulating your questions ahead of time. And then, of course, Casey will put in the chat a tool that Komen uses. We have questions to ask the doctor.
Okay, good.
And it's not a comprehensive list, but it's definitely a good starting point that you can print off and take with you to your appointment.
Right.
Or you can get a notebook or a journal and start to write out things that you want to ask ahead of time, so that you're kind of prepared with your questions ahead of time before you walk into the doctor's office. And then that kind of ensures that, one, the doctor hears your concerns, and then hopefully based on their responses, you feel that that feedback or their responses were helpful to help you, again, make the best decision for you, for your treatment. So it's important, and if you need assistance, Komen's navigation team is here. We can help facilitate those conversations or help facilitate the list of questions that you might need assistance with. Or don't, again, that could be the area where, yes, family and friends want to help. So maybe if someone is willing to be the note taker or help you come up with those questions, lean into that. Delegate, if that's how you need them to help, be specific that I need you in this area.
Yeah, and I think particularly with the metastatic community, that word itself is frightening, never mind metastatic breast cancer, all of those which are terrifying to most people. Time isn't something that most patients think they have. And I can appreciate that, and I know you can as well. And then there's that overwhelming amount of information that's available, and not always from good sources. I'm so glad that Komen has, this helpline that is, I certainly feel comfortable directing any patients to, and I know the information that they're going to get is good. So how do you talk to a patient about that issue of time when to them they don't feel they have any time? Something needs to be done immediately, and very often it's they think something more dramatic or needs to be done than that does.
Sure.
How do you do
Yeah.
that?
So we hope that we can jump in kind of, hopefully they've reached out after their diagnosis. That definitely helps to get the conversation facilitated and kind of help sort through some of that stuff. So definitely reach out to Komen.org, or don't be afraid to ask within your cancer center, is there someone available that can really help me sort out this information and help me kind of along, help guide me as to, what is my time frame? Map that out for me. And sometimes that could be the provider, but it could be the nurse navigator or the social worker. And then, again, educate yourself on your diagnosis, on your specific type of cancer, on your hormone receptor status. Educate yourself on, the drugs or the chemo that they want to use in your treatment. And then, yes, use reliable resources. So yes, the plethora of information that's at our fingertips right now, that alone is a daunting process. Just to look on one website, it's hyperlinked, and then you got to go to another page. But use reputable resources like Komen.org, American Cancer Society, National Comprehensive Center Cancer, Center Network. And you can always ask your provider or the nurse, what are reputable sites? What are credible sites? Because you could go off on Google and just find all of this information that really isn't accurate or can make you, again, panic. So really use a trusted resource. Speak to your healthcare team or navigator to address kind of the time sensitivity issue that you may be faced with.
And again, you mentioned, telehealth, which if something is good is going to come out of COVID, I think that's it, because you're going to be able to reach populations that maybe aren't close to a comprehensive cancer center or don't even know what a comprehensive cancer center is. As you know, most people are treated in community settings, and the language, again, not just the language, the medical language, but language itself is oh, good. Here's some. Do you want to go through this?
Yeah, sure. So coming back to that, not, maybe not having access to, a comprehensive cancer center and you're more in a community setting or in a rural setting, or, maybe you are at the latest and greatest cancer treatment place, but you can always do your research on the quality of the providers by using I think I have it over here, American Society of Clinical Oncology's website or National Cancer Institute designated cancer centers. So to make sure that provider, specializes in your area of, or in your type of breast cancer, or maybe you're seeking, again, you don't have a doctor and you need to find one, or maybe you're seeking a second opinion. Do your research on the provider. You can also look, a lot of them on their own kind of health system website will have a list of providers and kind of what their background and training has been and what their areas of expertise are or their research specialties are. So you can start there or utilize those search engines to find a high quality care provider for yourself. But yeah, here on the slide, kind of took some key points from a definition of patient self-advocacy that I found from Metastatic Trial Talk. And they define it as the ability to address health-related issues by making informed decisions about your health, communicating effectively with your healthcare team, and another component, which is connecting with others. And, why is self-advocacy so important now? And I think as you hear more cancer centers or more healthcare systems are taking a more patient-centered care approach. They're allowing patients to use their voice in their cancer care. They're, presenting those options, as Dr. Feinstone mentioned, and for you to have more of an active role in your cancer care, which is shown to possibly, improve quality of life, and it gives the patients a sense of empowerment or ownership over their care, which is important. So
I think so too. The slide here, one of the bullet points is to seek a second opinion. Do you think that most patients feel confident enough to do that? They don't feel that it's a betrayal of the physician that they're introduced to?
Good point. So I would say, at least from my experience and the patients that we work with, no, they are not comfortable. I mean, of course, there are some. I would say most of them aren't necessarily even comfortable questioning their current provider, let alone say, well, let me go find another one. So some of that is more of an educational kind of component that we do in navigation to say that, hey, you can seek a second opinion. You're not going to betray your doctor. You're not going to offend them. And it's a good way to, one, confirm your diagnosis and confirm your treatment options. Maybe you'll have better treatment options. Maybe there's another provider that's really more specialized, or that can connect you to clinical trials, which are important. So, I think at least the experience that we've had with our patients that we see in our navigation program, most have not considered that, and sometimes it's not. It may not be an option sometimes due to insurance or location.
Right.
Again, like if you're rural and that's the only center, are they willing? We can ask, are you willing to travel? Some do across state lines sometimes, but maybe that's just not an option. But they can still even, if there's another practice at least in the area, could still seek something that's close to home, but sometimes that's still not an option.
The issue of clinical trials, I think I'd like to discuss a little bit, if you don't mind.
Mhm.
I don't think, and you tell me what your experience has been, but for me, that's not a first thought for patients, is to participate in the trial.
Mhm.
And in the metastatic community in particular, I think that may be a very good option for them sometimes. What is your opinion, or what are your thoughts?
I think it depends on each individual. I've had some patients where, yes, that's kind of brought up during our intake, kind of the first thing on their mind. And then some patients have been, in treatment for a while, living with their diagnosis for a while, and it comes up because maybe the provider did bring it up, but maybe it was more of a word of mouth kind of situation. I think it still depends on the individual. Some are much more aware of those kind of research options and trials. And again, it kind of comes out immediately. Others, it may come up later throughout their treatment, or some folks, I think another barrier that we see too, to sometimes, Dr. Feinstone, is that sometimes it's not even offered. So they don't know that is a possibility, but it's not offered. So again, particularly when we, look at, our communities of color or underserved populations, making sure that they understand that that could be an option if something's available in your area, and please speak with your provider. And again, I think we have questions that we can, use as kind of a starting point to get those conversations going.
Yeah.
It just depends. Yeah.
Yeah, it depends. And you touched on it a little bit, but there are some communities that sort of adverse to the thought of a clinical trial, or have thoughts that they won't even go there, which is what is the difference between a navigator, a hospital case manager, or a social worker? Because not everybody has in their facility or in their communities
Correct.
patient navigator. Do you mind just?
Yeah, sure. Yeah. And I can say that there's some similarities that run, amongst each role, but it depends. So you could have a nurse navigator who can provide a lot of the kind of clinical support, like side effect management, or connecting you to like a prescription assistance program for a certain drug that you may need. You may have social workers who provide resource navigation, but they also provide counseling or therapy, or that's maybe they only provide counseling or therapy. Patient navigators tend to address a little bit more of the non-medical needs, or some of those barriers to care, or provide some of that educational components of care around, like, helping someone understand their health insurance benefits and how to optimize those, getting them connected to like financial assistance programs, and actually, helping the person complete the application or gather those documents, helping with like logistical things like transportation barriers, childcare or food or housing is a big one right now. So it really depends on the role that has been kind of defined for that either nurse navigator, case manager, social worker at that cancer center. What is their scope? What is their role? So again, I know even in my personal experience, the social worker that I had was able to provide counseling, but she was also able to connect me to resources. So it just depends. And then some nurse navigators also will do resource navigation in addition to the clinical piece of your care too. So you would ask, are any of those available? And then, if someone is, you can ask them to kind of define their role and their scope and what they can and cannot do. And if they're limited in one thing, then, see if there's an option, if the nurse can only handle your clinical stuff, then see if your insurance allows you to get connected to a social worker outside of for more of the emotional support or resource navigation. So,
Yeah, I
Mhm.
think those points that you're making are extremely important. And again, I'm not sure they're always addressed. Certainly not in the discussion with the doctor when he
Mhm.
or she and you as a patient are making decisions. But those are hugely important. Getting to treatment, when you can come to treatment, how it's going to impact your job.
Mhm.
Do you have small children in the home? Do you
Mhm.
live alone? I mean, all of those, the cost of those kinds of things aside, just the
Mhm.
getting to treatment is sometimes can be a challenge for patients.
Mhm.
It's good that you're in your discussions with patients that you're asking or encouraging them to talk to other providers, like you say, nurse navigators, social workers,
Mhm.
someone within that hospital setting that can
Mhm.
look at those kinds of issues as well. Because
Mhm.
very, very often, and I'm sure you'll agree with me, that very, very often those are a bigger part of them making a decision about what the treatment is
Mhm.
than other factors in their life.
Mhm.
And
Sure.
I'm not sure that's always discussed.
Sure. Those underlying factors that really can impact
Yeah,
outcomes. So really addressing those is kind of what navigation does, whether it's provided by a nurse, a social worker, or a non-clinically licensed navigator, but at least definitely ask. Some cancer centers, they're automatically assigned to you. I'm sure some of the larger ones, but definitely ask. And then if not available, you can always connect with Komen.org, our helpline, and they'll get you connected to a navigator.
it's wonderful. So we're talking about self-advocacy and certainly in the realm of communicating and who do you communicate to, how do you communicate with different parts of your healthcare team effectively? What do you tell a patient if they feel the doctor isn't listening to them? How do you
Mhm.
encourage them to take care of that problem?
Mhm. So again, I think we could start with by, bringing someone along with you, to make sure that one, you're understanding, and that the doctor is actively listening to you, or maybe they can kind of ask questions, to see if they're getting kind of the same feedback. And then it's a matter of, again, you know, if you don't feel that they're listening, are you able to seek a second opinion, or are you willing? And if that's the case, then let's talk about facilitating how that could happen. Because not only is it just pick up the phone, call, let's get another doctor. Again, you want to do research that it's a high quality care provider. And then, there's also the logistics of you have to get your medical records transferred. You got to, get all your scans over there. You got to sign a medical release form. So I think from a navigation perspective, would be some education around, well, let's start on how we can facilitate a conversation with your current doctor to see if that can help improve the effectiveness of your conversations. Bring someone with you, or are you willing to seek a second opinion? If so, here's the steps that need to happen, and here's where we can help assist.
Excellent, excellent. How do you get over the barrier of the patient not wanting to challenge the doctor, but thinking that the doctor knows best? This is their area of expertise,
Mm-hmm.
and relying solely on them. How do you
Mm-hmm.
give the patient that voice?
Yeah. I've actually experienced that with a couple of patients, and particularly my elderly patients. Um, they
That's all.
think the doctor is, yeah, they think the doctor is like they're the be all end all and it is their word. And one of my patients literally said to me, I can question the doctor. It was a matter of, you know, I don't think that they really understood that you can ask questions. Um, and sometimes that's more of just, that could take time. It's educational. Like, you know, you are your best advocate. Really educating that you are the best advocate for your cancer care. You know what's best for you and your situation. You know what works, what's feasible. And just kind of really providing that encouragement and that support and the education to say you can. And sometimes it could just, like that particular patient did, I mean, literally didn't think that she had time to ask the provider questions. She felt
Oh.
rushed. And so I said, well, let's change it up. I said, maybe you ask your questions at the beginning of the appointment. And then that way, most of your time could be spent with your questions, and then they can do the exam maybe. She's like, I can really do that. I was like, you can really do that. You can change it up. So there's a little bit of some education and some encouragement at first to get them to understand that you can ask questions and question their kind of expertise because you know what's best for you.
Yeah, that's really empowering for the patients to know that you and the other patient navigates at Komen are sort of behind them, supporting them,
Mhm,
and not challenging, but just taking care of, you know,
mhm,
your own best interest.
mhm.
That's why I love the idea of questions to ask the patient. That sort of takes it away from a challenging kind of thing. It's
Mhm,
almost like they're bringing their homework to the doctor.
mhm,
Right?
mhm.
My navigator told me I have to fill in these blanks. And it,
Yeah, I actually had a case like that too.
yeah,
And how much after that appointment, when she walked in there with her own kind of care plan that we filled out, she said, wow, the doctor really was like impressed.
yeah, yeah,
So yeah, it is. It's good to hear my patients say that they feel so much more empowered to ask questions and have a conversation with a provider. Um, it is, you know, it's a two-way kind of communication, and you have every right to be involved in your cancer care. Um,
I agree. Do you find, I have found, and I'm asking if this is your experience as well, that, and again, I'm going back to my mantra that informed patients make better doctors. But I think that the doctor actually appreciates the fact that the patient has gone to that, taken the time to learn about it, to again, not challenge them, but make the conversation a two-way conversation.
mhm.
This is what
Yeah,
I think. This is what
yeah.
I think I'm understanding. Can you clarify this for me?
Mhm,
So,
mhm. Yeah.
um,
And as I think, you know, again, as I pointed out earlier, as you know, our healthcare systems and our cancer centers take more of this patient-centered care approach. I know even in my own care, my radiation oncologist would always ask, so repeat back to me what I just told you. And so they want to hear kind of like in your own language, like we talked about earlier, you know, what did you get out of that? So I know also, you know, there was always like a teach back method in like health coaching and health education. So I refer to this as like the repeat back method. It's like, so regurgitate it to them, whether they ask you or not, and see, you know, did you get it right? Was something missed? And they can explain it again, or clarify some points. So repeat it back in your own language and see, you know, if you're getting the key point, the gist of it. And I think doctors, like you said, they appreciate that, the engagement and the opportunity to work together. Is
yeah.
a new approach, you know, over, like you said, over the last
Oh, yeah, there's no question
years. Yeah,
that,
right,
yeah,
exactly.
yeah, women my age never challenged their parents or the doctor. But
Mhm.
a question came in, let me read it to you and then see what your response is. I had a hard time going for a second opinion. Whoops, what happened there? It just went away. Casey, do you mind putting that question back up again? Thank you. Anyways, she said, I'll paraphrase. I'd rather read.
It's in the chat.
It's in the chat. Okay.
Yes, ma'am.
Okay. Okay. I had a hard time going for a second opinion. I feel funny, second guessing my I felt funny second guessing my doctor, but honestly, we question lesser things in our lives, which I think is a pretty profound statement. Like we get multiple estimates for home improvements. You guys, they don't know, but before we were talking, your gardener was there and one of the other staff had a plumber there. So these things are part of our everyday life. But anyways, she says in this comment, and I think this is important, that in the end, my doctor welcomed the second opinion.
Good. Yeah, I love that. You know, healthcare is one of those kind of interesting things as consumers. Like she just mentioned, we don't approach the same as we would something else. You know, when we go and buy a car, we know the cost already, right? We should know the cost of healthcare before we show up. But same here, you know, it's kind of like getting different quotes on things. They're getting different perspectives on things. I think just the way that we do with other things that we consume, why not do it in our healthcare? And yeah, I think, I mean, most patients report, yeah, the doctors are not offended. They are glad you're seeking a second opinion. And then if they're not, then that should tell you right then and there, you should go get a second opinion, I think. So good. Yeah. But yeah. And it's not easy, of course. I know even for myself, it's not easy to approach doctors because they are experts in some ways and have all this expertise and stuff. But, you know, you are still ultimately the best advocate for you. And it does not hurt to ask, and it does not hurt to seek a second opinion.
That white coat can be sometimes there's no
Yeah.
yeah, that is an issue. I would like to let the audience know something about Komen that they may not know. I am very privileged to sit as the advocate on the Komen Scientific Advisory Board. And when they go on the website, they can see the names of the doctors, the Komen scholars are amazing. And the Scientific Advisory Board is made up, and again, it's my privilege to share that with them, but is made up of world-renowned, not just research investigators, but clinicians as well. And I will tell you without exception, the work that they do is not to benefit themselves, but to benefit the patients. And I think that my experience, and probably yours as well, that really describes most doctors, that they're there for the patient. And I think that they appreciate a patient that is advocating for themselves. Maybe that's too strong of a word for some people, but educating themselves about the process. And I really think that that's important. And I think that Komen should be very proud that these world-renowned clinicians and researchers support Komen and what they do. And women should be, patients, women, the whole community sort of applaud the fact that Komen is so respected in the medical world. But the other thing to remember is that those doctors, even though they're wearing that white coat, they put their shoes on in the morning just the same as we do, you know, just the same as we do. They may speak a different language, but I think most of them are willing to speak your language if you ask them to. And I think you posed that really well. That could you explain that to me? This is my understanding of what you just said. Is that correct? That's really a really good point to make with patients in that shared sort of decision making.
Yeah. And ultimately too, I think in the shared decision making process, you know, this is a big paradigm shift, and you know, hopefully some of that training will begin to take place in med schools and in research settings, so that when they are patient facing, you know, they are kind of still communicating in their language, but able to tailor it to where we can understand when we need to. So, yeah.
Right. I had a clinician, actually one of the clinicians that were on the scientific advisory board, and he was talking to a patient group one time at a meeting, and he said, think of cancer as a rooming house for criminals. And in that rooming house, sometimes they're like petty thieves, and sometimes they're serial killers. And you have to find out which of those criminals is in your house and what the appropriate treatment for them is. And I think that when you've been diagnosed metastatic, it's so overwhelming because that word is just devastating for most people. But I would like to share with the audience today that I have many friends, and I believe you probably have them as well, who are metastatic and are living very fulfilling lives 25 years after their metastatic diagnosis. That treatment has come a long way, and a lot of focus is being put into the metastatic realm to help patients get through it. Cure isn't a word that's used in the metastatic community, but it doesn't mean that you can't live a full and fulfilling life, even managing this disease.
Yeah. And self-advocacy is definitely a part of ensuring that you have that quality of life. It's just one component of that. So,
yeah, I have a feisty little French woman in my support group, and she's metastatic, originally diagnosed over 25 years ago. And as we're finding some of these cancers come back, unfortunately, but she pretty much tells her doctor what she wants to do. And she does it in such a way that they do talk together and they negotiate, and she has this lovely little French accent, so she gets away with lots because of that. But and I was going to say in small things, but not so small things, and I'll give you two examples. In the infusion room where she gets her treatment, the staff thought it would be nice if the patients had rockers, so they could sort of rock and relax when they're getting treatment. But to someone who's not feeling particularly well, that rocking is not a good thing.
Emotion, yeah.
Emotion isn't good. So here's something that started out as a thoughtful kindness to patients really wasn't. And had the staff spoken to patients about that, they would have told them, oh, not a good idea, just not a good idea. But my little lady did, and guess what? The rocking chairs are gone.
Yeah. And, we would hope that before any kind of change is made in a cancer setting, that they would do a needs assessment, because ultimately it affects the patient. But if they don't, then speak up. Speak up and be persistent if you need to.
Yeah. Another thing she did that may seem silly, but I'd like to share with you, is that in most buildings, whether it's an infusion room or what have you, the the electrical connections are way low down, and that's so it won't interfere sort of with the decor of the room. Well, she saw nurses bending over, putting in, taking out, bending over. So she had them move the electrical outlets higher up. And that was not for her or the other patients, but rather for the nurses that were caring for them. So sometimes patients can have these, amazing kind of suggestions. And unfortunately, those conversations are not always had.
And speaking of suggestions too, I know a lot of cancer centers do send out patient surveys. So I encourage patients to complete those.
Right.
Be honest, they are looking for feedback and ways to improve their processes or interactions with patients. So if you receive those, I know sometimes you can be inundated with multiple, but at least, fill it out once. Or if you're not connecting with your provider, then, fill that survey out, bring it to the attention of some administrators or the folks that really do make those kind of, clinic flows and processes within the clinic. So I encourage you to fill out surveys if you can.
Yeah.
Or positive reinforce or positive feedback is great too. I mean, we think doctors are just, they're overwhelmed too. So sometimes it might be good for them to hear that they've really served a patient well. So yeah.
And I'll tell you one more thing. I keep bragging about her with I because I think she's kind of amazing. But she's little. She's really little. And she found that if her infusion was extended, not given in a shorter period of time, that she could handle it better and she had a lot less side effects. And so her and her physician worked that out. And it sounds like a simple thing, but it's not such a simple
It's just
thing.
an ask. It is just a request and an ask. Yep.
Yeah. And it's wonderful if patients learn that they can have that relationship with their doctors.
Mm-hmm.
And certainly with the staff that
Mm-hmm.
that's caring for them.
Mm-hmm. Absolutely.
Yeah. That what is the website again for Komen so that those are what?
Yeah. So folks can go to komen.org. And here we have a slide for our Komen's Patient Care Center. Or you can contact our breast care helpline at 1-877-GO-KOMEN or through email at helpline@komen.org. And there you can be connected to a culturally responsive navigator. And we can provide educational resources, emotional support, get you connected to financial assistance. So if you or anyone you know needs assistance, please feel free to reach out to our website, contact our breast care helpline.
That's wonderful. That's wonderful that that resource is available to them.
Mhm.
Could I ask what is your most common kinds of questions that you get on the helpline? What are the most questions that
At least through, folks that we've navigated, I think, I mean, again, it depends. But if you're asking about maybe what kind of barriers we're seeing, definitely housing is a big challenge right now with the cost of rent or, folks are either, and they're in treatment, balancing, what do I pay for treatment or housing. Transportation is definitely a barrier to care. Folks that are newly diagnosed metastatic, of course, some emotional needs, some emotional support, and needing some of that education to, again, like, what does this mean? Where do I go from here? How do I start these conversations? And even, again, comes back to educating about the many different types of providers that they're going to see. So we see a lot of that. Getting connected sometimes to support groups is an interest or a question, but really, and then financial resources. Yeah. For whether it be to help cover costs of medical expenses or basic living expenses, we help get connected to programs that provide financial assistance to breast cancer patients. So.
Tony, is there a question that I should have asked you that I haven't asked? Is there something that you want to add or?
No, I think I just put under, we had connected with others, whether that be, ask for a navigator or social worker. I'll also just kind of state, getting connected to metastatic breast cancer support groups. While those aren't ideal for everyone, at least with my experience with my patients, a lot of them have reported feeling a sense of connection, particularly with someone who has a similar experience. And that is kind of where they really learn how to navigate that diagnosis. They learn from each other. the resource, or try this tip, try this strategy. So those can be beneficial. And again, I understand they're not for everyone. And I've heard too, specifically having a support group that is specific to metastatic, and because it is a different experience. And then, just connection, getting those educational resources, no matter where you are in a journey, whether you're newly diagnosed with metastatic or you, like you said, been living with it, continue to educate yourself. As you said, the researchers, the treatment options are ever evolving. What the gold standard was 5 years ago is no longer the gold standard. So keep educating yourself and reassessing what's next for me, what's the best option for me. Ask about clinical trials too. Bring that's another question to bring that conversation up. Is that an option for me? Have those discussions.
The one thing I didn't mention, and I think we have time, I'll try not to belabor the point, but you spoke about bringing a family member to the meeting with the doctor to take notes or to have a second ear so that there is clearly what's being said. How do you address the issue of family or friends that are encouraging you to go in one direction and you know that it's in your best interest to do something else?
Yeah, and those are hard conversations because we do know that our family and friends love us. They want to support us. They're trying to help. But again, I'll bring it back to really just, you got to express what you need and how you feel and where you think you're going. And if you need additional support in those conversations, that's where I would maybe, recommend and refer out to therapists or counselors to kind of help have those conversations, because those ones aren't easy either. So, again, share your concerns, share your feelings, and you, again, ultimately know what's best for you, and then try to have someone support you in that conversation on how you're going to explain, well, I know you're trying to help. This is what's best for me.
Yeah, and it's an opportunity for the patient to educate the family or friend as well about what you don't, maybe you didn't know this, or this is how it was explained to me. Do you have support? I agree with you totally about the issue of support groups. They're not to give medical advice. That's certainly not the place for it. But they can talk about how to manage things that information that's usually not given, not medical information, but just little tips on how to manage things. And that is an amazing resource. Do you help match up patients to those kinds of groups?
So Komen does have a metastatic breast cancer Facebook support group. So it is a private closed group that you can join through Facebook. You can definitely ask your cancer center, do they have one specific for metastatic breast cancer? There are local, and of course locally, there's one here, I'm in Charlotte, that's not affiliated necessarily with a hospital system, but they have their own kind of support group where they meet. So again, ask your cancer center. You can join Komen's MBC Facebook group, or look for any local kind of groups that meet. Facebook outside of even Komen is a good resource to find those kind of groups locally too. So yeah.
Good, excellent, thank you. Well, I can't thank you enough. I think the information you've given is going to be very, very valuable.
Oh, thank you.
Have joined. And Casey, I'd like to turn it back to you.
Wonderful. Thank you both so much. You shared so much valuable information, experiences. Thank you for being open enough and sharing your stories, your personal stories, because I think there's a lot to be said for sharing somebody else is experiencing that now. And to know that they aren't the only one going through it can sometimes be just so impactful. If you are watching this recording in the future, audience, you have missed a bunch of links in the chat as resources. So if any of the points that Dr. Feinstone or Tony talked about, those resources that they highlighted, if you're wanting to get your hands on them, there's two easy ways to do that without having access to the chat feature. The first is to call the Komen helpline. at 1-877-GO-KOMEN. Or if you're an introvert like me and you don't like talking on the phone, you can email helpline@komen.org. And you can ask for this information or ask to be directed to it, and we'll be able to get it into your hands. The second, if you're super introverted and don't want contact just yet, or you're just educating yourself, getting a lay of the landscape, just Google Komen metastatic breast cancer. And the first two links that pop up are going to be really useful. The first is our metastatic breast cancer page, which is a wealth of information. It is what does that diagnosis mean? What are the kinds of treatments you can expect? What are those treatments? Are you interested in learning more about clinical trials? Anything and everything with MBC will be linked on that page. And it will be take some time for you to tease your way through all of it, but it is a lot, and it would help you if you're in that early education portion of your journey there. The second is actually a link to the Impact Series program, which you're attending today. So we record different sessions every month, all kinds of topics, and they're posted online. You can watch at your leisure. We also do newsletters where we share a variety of resources every single month. So if that is something that appeals to you, having some additional support and resources right into your inbox, please subscribe to our newsletter. We try to highlight different organizations and different events going on around the country that we find out about. So thank you so much for attending today. We are so excited. Thank you again, Tony and Dr. Feinstone, for your fabulous speaking and moderation. As I mentioned, the session is being recorded and it will be posted to our landing page very, very soon, so you can rewatch or share. And please help us spread the word so that we can make sure we're reaching in to the MBC community to share this information. And of course, any friends, family, healthcare professionals that you think would be interested or find it valuable. Once again, we want to acknowledge our sponsors of the 2023 Impact Series. Their generous support allows us to continue to bring this community together so we can share important information, resources, and experiences. So a very special thank you to AstraZeneca for being the technology sponsor. We also would like to thank our premier sponsor, GE Healthcare, and our signature sponsors, Walgreens and Merck. The series is made possible because of their ongoing generosity. Also, last thing, please help us by completing a survey, which you can now find in the chat feature. Your feedback is really important to helping future programming. I manage the program. I read these things. I promise you it's going somewhere. And it does help us pick topics, restructure things, and make sure we're delivering information that's valuable in a way that it can reach you and be useful. So finally, the next event will be on August 16th and is focused on MBC advocacy and public policy. So if you're interested in attending this event, you can register now on our landing page. The landing page is that second Google link that I mentioned earlier. Otherwise, thank you for joining us today. Thank you for all who made the event possible, and stay safe and stay connected.
Thank you.
Bye.
Bye-bye.